Dr. Sarah Patterson is a hematologist working in the McMaster Hemoglobinopathy Clinic at Hamilton Health Sciences in Hamilton, Ontario. She completed medical school at Queen's University and her internal medicine and adult hematology residencies at McMaster University. She's been working with the McMaster Hemoglobinopathy team since graduation and is undertaking further training in subspecialized care of hemoglobinopathy patients, health advocacy, and health literacy. Thank you, Sarah. We welcome you.
Thank you so much, Karen. It's my great pleasure to be moderating this session, the simultaneous session on the RBCD Hub, the experiences of innovating patient education. We're going to have questions in the chat or the Q&A box. You can also raise your hand and we'll be able to unmute you if you wish to speak yourself and ask questions. I'm going to go ahead and introduce our three speakers in alphabetical order. First, we have James Bradley. James Bradley is a transition navigator with the hemoglobinopathy program, working with the Hospital for Sick Children in the Toronto General Hospital. He supports adolescents and young adults with hemoglobinopathies and their transition from pediatric to adult care, including transition readiness, psychosocial support, resource navigation, goal setting, developing self-management skills, and ensuring a seamless overall transition to adult care. James graduated from the University of British Columbia Masters of Occupational Therapy program in 2013. Our second speaker is Colleen Johnson. Colleen has held the position of nurse practitioner in the Red Blood Cell Disorders Clinic at Toronto General Hospital for the last 10 years. Throughout her career, Colleen has held many nursing roles, including educator, nurse manager, and now nurse practitioner. She worked many years ago in oncology and palliative care before changing specialties. In addition to her clinical assessments and telephone triage role, her other focus has been on transitioning patients from the Hospital for Sick Children, as well as leading various other projects within the program, including immunizations for asplenia. Our third speaker is Cynthia Shrikanthan, I'm sorry. Cynthia is a social worker at the Toronto General Hospital's Red Blood Cell Disorders Clinic. There, Cynthia brings together counseling with advocacy practice to support patients. She has a strong foundation in community-based social work, including areas such as youth work, gender-based violence, housing and homelessness, and settlement services. She also has a background in qualitative research. So it's my pleasure to introduce these fantastic speakers, and we're looking forward to the presentation. Again, please ensure you're on mute so that the presentation continues smoothly. Questions in the chat and the Q&A box, and we'll do our best to address them. Thank you.
Hi, everyone. My name is Cynthia Shrikanthan. Thank you, Dr. Patterson, for that wonderful introduction. My pronouns are she, her. I'm here with my colleagues, James Bradley. James, are you there? Do you want to quickly say hi?
Yes, hi,
Okay.
Sindhu. Hi, everybody.
Okay.
Thanks for joining us today.
And I'm also here with Colleen Johnson. Colleen, are you there? We had some technical issues. I'm not sure if she's there. Colleen, are you there?
So no, she hasn't been able to join us yet. We're still working on that. Yeah.
Okay, so I'm going to be presenting a little bit on Colleen's slides. Colleen, if you make it, please interrupt me and go ahead, okay? So we're here to talk about our project, the RBCD Hub. And basically, it's an online website that is going to be launching in the next 24 hours. So we wanted to talk a little bit about our experiences. We were kind of, mandated to take a patient education kind of approach, but our experience and our process, as you'll see, really kind of challenged that. So we wanted to kind of share that with you. So this is our disclosures. So our hopes for today. So we're going to set some context. We're going to talk a little bit about what patient education is, how it's discussed in the literature, and how patient education kind of is carried out at the RBCD in terms of our clinic. We will talk a bit about our process, our experiences, the challenges, and the opportunities that we experience. Finally, we're going to do a virtual tour of the RBCD hub. So it's not completely live yet, but we do have a password protected account. So we're going to share screen and just kind of share that with you guys. So the Red Blood Cell Disorders Clinic at UHN. So we are one of the largest clinics for hemoglobinopathy care in North America. And we provide comprehensive care for adults with red blood cell disorders. Right now, our team consists of hematologists. We have transition navigator, James, who helps patients adjust from pediatric care to adult care. We have nurse practitioners, including Colleen, and then we have a social worker, myself. Our staffing model will be changing soon, but this is our team right now. So a little bit of information about patient education and also with a focus on red blood cell disorder patient communities. So the literature and also our practice experience tells us that in the global north, red blood cell disorder patients, they often come from racialized and newcomer communities. And in terms of health literacy, the literature tells us that it is very variable. Some folks have very excellent health literacy. Some folks may have a little bit more limitations. So there's a range in terms of health literacy. The literature also tells us that for people with red blood cell disorders, there's a lot of barriers that they encounter in terms of accessing information on community resources. So that also impacts your health if you aren't able to access resources. And then also information about accessing like benefits and entitlements. There's a lot of knowledge barriers in terms of getting that information, which also impacts your well-being. And when I talk about entitlements, I mean like stuff like income supports and resources and stuff like that. The literature also tells us, and so does our so does our practice experience, is that people who have chronic illnesses like sickle cell disease and thalassemia, they also have vast amounts of knowledge from their lived experiences that really, we can't really we can't tell people how to live with their chronic condition, right? So patients also have a vast amount of knowledge that's not really captured in a lot of the patient education resources. So another piece is that patient education in terms of the mainstream kind of approach is often done in a top-down way, so sort of a medical model. And it kind of assumes that patients have no knowledge, right? And this becomes a little bit problematic when we consider that patients have like a lifetime experience of managing and living with chronic illness. A lot of education resources lack structural barriers to care, which we mentioned. So it doesn't really take into account racism or poverty and how that impacts your ability to manage your health. And then finally, patient education, the mainstream approach kind of neglects patients' knowledges that I mentioned. The literature and also our experiences tells us that patients' health information needs is not just medical, but there's also like various dimensions, including mental health, the socio-political context, and then also developmental dimensions. So, in terms of, transitioning from being a child to like a young adult, to adulthood, into old age, right? These are all developmental considerations that health information needs to take into consideration for providing. Anyway, so the point is, though, there is a need for resources and processes that promote patient participation, social justice, and empowerment. So that's a need for patient education when you think about hemoglobinopathies. Okay, Colleen, are you there? Okay, so this is Colleen's part. So I'm gonna, oh my gosh, sorry guys. So I'll speak to her part. So I wanted to briefly talk a little bit about the local context in terms of the red blood cell disorders clinic and how we have taken up patient education. So in the past, there was a quarterly publication of a print newsletter, which featured patient narratives. It had clinic news, And it also had articles about health information. This was led by, the previous social worker, Dr. Heather Gordon, along with the interdisciplinary team. And then right now, there are 3 existing patient education resources: sickle cell pain episodes, priapism and sickle cell disease, and iron chelation therapy. So these, if you look at these resources, they are available online. They're quite regimented. They're very medical. There's not really an experiential component, and there's not really like any analysis of, how does like racism, for example, impact your experience of pain episode and the ED, for example, right? So there are some resources, but again, that social context, experiential dimension is not really captured in those resources. Then finally, there is also like throughout the last few years, there's been interest for online platforms and kind of connection and engagement. And then the COVID-19 pandemic hit us, and this brought another context to patient education, patient connection. So print newsletters were no longer feasible, especially as virtual care became a norm. It wouldn't really make sense for us to make print resources that would it would be hard to get those resources to the patients, especially if they weren't coming into a clinic. With the pandemic and the lockdown, there was a strong desire amongst patients as well as the care team for connection and a sense of community. And this was like communicated to us like individually, right? Also, the pandemic, there was a racialized, impact, right? First of all, the murder of George Floyd had a collective traumatic impact in terms of racial trauma. And it really brought that to the forefront for patients and so forth. And then also another piece is the pandemic had a racialized impact in terms of who was impacted, right? A lot of our patient communities were impacted. There was a lot of grief and trauma in terms of lives lost with the pandemic. So again, this speaks to the need for community connection, but also it also speaks for the need for patient education resources to take up those structural barriers to care, which always existed, right? But really came to the forefront. So then we had an opportunity, which was at UHN, there was a call for funding grants, right? Or funding proposal. So the blood disorders program, they had a clinical innovation fund. And so James and I, we proposed this as a project. Okay, so the vision, we wanted to create kind of an online hub of resources. So this would include, common resources that we would refer to patients or what patients would ask about. We wanted to have like a directory with meaningful stories. And this is also part of the newsletters. They were so meaningful for patients because they got to see themselves, they got to see other people, and see their challenges and their success. So that was also a hope. We wanted to have information that was tailored to the RBCD patient community. So how does, for example, EI sick benefits, how does that benefit a patient who might have episodic periods of illness? So we wanted to, really tailor what resources that exist to meet the patient's everyday lived experience. We wanted a website that could also have a social action component. So we wanted to really challenge stigma related to red blood cell disorders, and we wanted to use it to increase awareness. And finally, I go back to like the patient's knowledge and their skills, right? We're learning from patients as healthcare providers. So we wanted a project that would capture or would enable like, multi-directional learning. It would enable like capacity building. So like opportunity for patients to get like their name on things and have their, get publications, for example. We're learning together with patients, and then also have a participatory process. So it's not top down, but we work with patients to get their ideas out in our final project. Okay, so James, I'm going to hand it to you to talk a bit about our process.
Great, thank you so much, Sindhu. I'm trying to start my video and it's saying unable to start video. So I'll just go ahead and just go with my audio for now. So so my name is James and I'll be going over the process that we came up with this project. So the timeline here starts way back in spring, early spring, summer 2021. So at this time we had applied to the grant that Sindhu mentioned. And we were getting started with, we had our idea and we wanted to move forward with the next steps. So at this time, we decided to build an editorial committee or an editorial team that consisted of red blood cell disorder patients, so people living with sickle cell disease and thalassemia, and also put the call out to staff members within the red blood cell clinic to see who was interested in participating. So moving on from here, we created a group and we scheduled our first meeting for fall of 2021. So this was our first editorial group meeting, really to sort of set the stage and, with what we were doing, what our goals were, what the processes would be, and really the purpose of having not only the editorial committee, but also the hub, the website. So just kind of getting everybody's ideas and input and deciding on a plan to move forward. From here, we moved into the winter of 2022. This was our second meeting. We, at this point, had a pretty good vision as to what we wanted to create. So we got into a little bit more of the nitty gritty, discussing topics that we might want to see published on the website, starting to get volunteers to write different articles, and then also starting to, because the staff members involved in this, we are, of course, a part of UHN. So we had to start to consider the organizational processes to go through, but also the connections we might have within UHN to kind of help guide us through this process. So moving on from there, we moved into March 2022. So knowing that we have this idea of creating a website, we wanted to do it in a way that was that we were all happy with. Of course, we looked to see if anybody on the team had experience with building a website, but of course, this is a complicated process that none of us really had a lot of experience with. So in our budget, we did have a piece for hiring a web designer. So in the spring of 2022, we started that process, getting quotes to help us with designing our project, and also finding the right fit of somebody interested in helping us with this. So moving forward from there into the spring and summer of 2022, we had our third editorial team meeting. So we continued to write and edit blog posts, with the blog being one of the major components of the hub, the website, which I'll be showing us in just a moment here. And then starting to, or I should say, continuing to build the website, which if anybody out there has been involved in building a website, it's many, many steps and lots of, feedback sessions. And I think my camera's maybe working now. So hello, everybody. So the process to build a website was quite eye-opening for myself. Getting, everything from design to font to colors to pictures, and then getting as much feedback from the editorial committee team as possible as well. And then moving forward from there into the fall of 2022, which is where we currently are, of course. So here's where we ended up getting a lot of more information around the UHN organizational side of things. So legal consultation, quality assurance, health education, talking to all the different programs and policy pieces within UHN that we need to consider to move this forward. All right, so having looked over our process, it was about 1.5 years of time. We thought we'd use the metaphor of roses and thorns to go over some of the roses or the positive experiences we had with this process, and also the thorns or the more challenging experiences. So in terms of starting with the positive, the roses, really bringing people together. So, this, as Sindhu mentioned, this was during a time when, COVID, we were kind of all isolating. We weren't interacting as much as we were used to. So having a common goal that we could meet together with both people living with sickle cell disease and thalassemia, and staff members as well at the red blood cell clinic. And also just a bit of a different context than what we are maybe usually meeting together about, right? So it was a positive experience to bring people together in that way. Of course, with a variety of different people, we had a diversity of voices involved in the program. So just getting different perspectives and different opinions was, created some really rich and positive discussions. I think we've created some really interesting, unique, and meaningful content. So when I pull up the webpage in a moment, we'll see some of the initial blog posts. We have 9 created for our launch. and just sort of monitoring some of the other posts that we've seen on different sites. I think we're going to have some really interesting, unique experiences from the articles that we have written and moving forward as well. We also kind of see the idea as writing as a form of therapy. So of course, as Sindhu mentioned quite a bit of the patient lived experience and that depth of knowledge that doesn't come across in traditional patient education approaches often. So having, what somebody may have been living with and experienced their whole life, getting the opportunity to reflect on that and think about that and write about that, using kind of that process as a form of therapy was an excellent part of this, the roses of this project. Also sparking critical debate. So of course, with a diversity of voices on the editorial committee, we had some really interesting discussions where different ideas or different opinions were had on different topics. And I think that's really important to the entire process as well. So we had a lot of good discussions as a group. And then increasing our knowledge of resources. So, a large part of, I know my role and Sindhu and Colleen's roles are providing community resources to patients or working to find those together. And we've been able to put together quite a long list of resources that I'll briefly show on the website today, and also find some more new and interesting resources, and we can continue to grow and have one place for those to live. And then, of course, the thorns. So it wasn't all roses. Managing the organizational complexities. So, of course, there was a lot of feeling like we were sort of wandering in the dark and maybe not knowing which program within UHN to even ask questions to about what we were doing. And just sort of taking it by, word of mouth and getting connected to different people took quite a bit of time. We also, of course, the red blood cell disorder clinic is within the cancer sort of oncology patient education department, consulting with public affairs and legal, and just seeing where our vision sort of fit within the larger organizational context was definitely challenging at times. No centralized communication methods. So in this, we're referring to getting people living with sickle cell disease and thalassemia involved in the program, or the project, I should say. We don't have a way to contact everybody in our clinic and see who's interested. So it was sort of, again, a word of mouth situation, but of course, we're still open to more people joining our editorial committee. And then the time. So from the clinician's perspective, balancing this on top of clinical work, and from the people living with sickle cell disease, managing that with their own personal lives, work, everything else going on in everybody's life. So it took a lot of time to coordinate different things, which is understandable. And then also the tension between health equity and mainstream patient education approaches. So again, as Sindhu mentioned, sort of that traditional top-down medical model prescriptive approach to patient education. In some of our consultations, we really felt that. And it's sort of, in a way it was a thorn, but in a way it also kind of highlighted the vision that we had and sort of helped bring that to life a little bit as well. Unexpected costs. So of course we had a budget that we were working within, and creating a website, anytime you need to make one little change to one image or font or section requires another approval of some funding. So working within a limited fund, that was challenging at times. However, we did manage to do what we needed to do there. And then just the idea of perfectionism. So, having lots of people that were really passionate about this project, and maybe having that trip us up at times and sort of hold us back from forward momentum, just wanting it to be, as perfect as we could make it. All right, so now I'm going to switch over and share my screen here. Okay, and I'll give us a little tour of the hub. So give me just one moment. I think this should do it. Can we see that? Can we see the website?
Yes, we can. It looks
yes, perfect. All right, so this is the very first look at the Red Blood Cell Disorders Hub. I'm a little bit nervous putting it out to the world for the first time. It's been a long time in the making, but here it is. So I'll do a brief run through of the site. So you can see this is kind of the welcome page here. We've got our logo up here. So welcome page just kind of says what we are here, an online space to connect about sickle cell disease, thalassemia, and other red blood cell disorders in Ontario. Scrolling down, we have featured articles, which take us to the blog posts, latest articles on the side here as well. Scroll down, and then you can even browse by topic. So each of our blog posts has like a tag associated with it. So you could click on, if you wanted to learn about advocacy, it'll take you to the blog posts that are linked to advocacy. Down here, just a little bit more about the blog and the hub here, and then just a contact form at the bottom. So I'll scroll back up to the top here. We'll go to about. So again, this tells us a little bit more about the hub, what red blood cell disorders are, and then kind of what the purpose of this hub is all about. So sharing information, knowledge, resources, connecting. If people have ideas, they can submit that. And then again, joining our community. Now, this is the one I'm most excited about, the blog right here. So these are where our blog posts or our stories sort of live. As I mentioned, for the launch, we'll have 9 posts. So you can see a few of the topics listed here. So balancing work, life, and chronic illness. One down with capitalism, how to better cope or how to better care for yourself while living with sickle cell. Yeah, so a variety. I won't go over all of them right now. They will be live very, very shortly for you to check out, but quite a variety to start with our launch. Right, and then I'll go over to resources. So this is one that I still am amazed by how much we're adding and kind of keeping in one spot here. So scroll down and really, again, I'm not going to go over all of them, but you can see we have a variety of different resources that at any time or another, we might be kind of supporting patients and getting connected to. But of course, this is one place where it can all live and be updated. And yeah, so quite a lot here. And then little, click down options here as well. Okay, and then our team. So if we have any team members on the line, they might see themselves here. Okay, so our editorial team, so there are more people, but certain people wanted to include their names in their pictures and bios here. So we have the names of a few of our fantastic editorial committee members here, and then anti-racism policy here as well. And then we, over here on the side, we have what we hope to be, connecting to Twitter, YouTube, and Instagram at some point. We don't have those up and running yet, though. So that is sort of the overview of the website. Sindhu or Colleen, now that you've joined us, do you have any pieces to mention about the site here?
I just want to say the blog part was I really am excited about the blog because it really brings up ideas that are not in, there's always a medical model with sickle cell disease, right? And for example, if you could scroll down, race, racism, and sickle cell disease, where it begins and where it ends. This article is really fantastic analysis about how racism was really built into the medical model, as well as how we think about understand sickle cell. And, really and truly, I, as a healthcare provider, I wouldn't know how to write that article, right? And really and truly, it comes from patient lived experience and supporting patients. The author, Vanessa Ferguson, right? Supporting the patient and writing, just, it was all their ideas, right? And, just supporting and encouraging, fantastic resource. And it really I don't know, I think it turns patient education on its head. It's more like patients kind of almost educating the healthcare provider in a sense too, right? So yeah, I love the blog content. It really makes it magical. Colleen, would you like to say anything?
No, I agree, Sindhu. I really believe it's time for patients to, it's an opportunity for patients really to participate. And I know people are ready to do that. They've been ready a long time. And finally, we have a forum that they can share their voice. So I'm very proud of it.
It's a really wonderful presentation, guys. We've got 5 minutes left in the end of our presentation. Lunch is from 11:45 till 12:05. And then there's the plenary session on curative treatments in sickle cell thereafter. We've already got questions coming in. There's a question of who's the artist. It's really stunning.
So the artist is from Be Fluent. So that's our web designer and their graphic designer team. Her name is Raquel Scott. So it'll be linked on our website.
That's awesome. And then a lot of questions on how can we get a blog post up? How do you get content? And how can we get access to this fantastic website?
So maybe after it's launched, we can email Sickle. It's going to be just basically rbcd.ca. but we'll email SCIGO so that it can be launched. And then how to get involved. So right now, we're working with RBCD patients. So please, ask any member of your care team, right? So whether it's the nurse practitioner, social worker, myself, or even the hematologist, like, hey, I heard about the blog, how do I get involved? They will flag to myself or James, and we will get in touch. So you can get involved. And we also going to have an email address on our website too. So that's another way. Right now, we're kind of working with UHN RBCD clinic patients, but we are open to like collaborating with other centers to help produce content. For example, like there is a blog post that a lawyer like co-wrote with us, right? Who is from a community legal clinic. So like we're interested in those kinds of collaborations as well.
Awesome. We'll wait for any more questions to come in. How about we have an anonymous attendee who's asking, what about those with educational needs or those who don't use English as a primary language, or those who don't have access to technology or the skills to navigate a website?
That's a really great question. So we are trying to build this resource with inclusive design. So it is also accessible on your phone, and it is like really big. In terms of the language piece, that's actually, yeah, we are still in a, like, this is something that is in development, but like we were thinking about having an interpretation, language translation feature embedded, but that is a really good need for us to consider for our project as we launch.
All right, got a few more minutes. I'd love to know what your vision for the future. That's open to Sindhu, to Colleen, to James. Where do you want to take this if the world is your oyster?
Colleen and James, do you want to start?
I'm happy to maybe say. So I think one of the big things when we were way back in the beginning when we were getting this started was, how can we make this kind of live on beyond the initial push of making this website. So the goal is to have it kind of live into the future, absolutely. And I think what I would like to see is just more avenues. So of course we have kind of written articles now. I think veering into more of the arts-based kind of approaches and whether that's podcasts or visual art or other mediums that we can kind of host on the site, I think would be excellent. So not just written kind of stories, which are great, but I think moving beyond that into some of the more media kind of things would be great.
Yeah, it's Colleen. I agree with James. I think links to YouTube videos, the podcasts like was mentioned. I think we've got the technology. Let's try and harvest it. And I know we have many patients who have experience in making videos and podcasts. And I think we need to just use that rich resource of patients to make this even better than it already is.
And then for myself, I want to see like connections, right? So, right now, as I said earlier, the medical model is so dominant, but I want to see like connecting to community resources, nursing perspectives, social work perspectives, patient perspectives, capitalism and sickle cell disease, like who would have thought that's a topic, right? So like, I just want to see like just the explosion of ideas and how we think and how we can support and build community.
It's really exciting times. We've gotten another question in the box from Ruth, who's asking, does the website support screen readers?
Is that like an iPad? Is that what a screen reader is? Sorry, I'm so sorry.
I wonder if it's, I'm also not sure, but Ruth is more than welcome to clarify. I wonder if it's for people who are visually impaired who help translate to audio, like who read it out for you.
Or is it, right, a screen reader, it's a part of inclusivity, right? Those that, I agree, it's a part of the inclusive way of looking at things. And I think that if I can jump in, I'm sorry, you guys, sometimes it's the web host itself, right? To see if they have those options around being inclusive in nature. Because interesting, when I made the Survey Monkey, it has this link for screen reader. I've never noticed it before, that you have a radio button just to help those and that they can select that while they complete the survey. So that's to me what they're asking you about.
Yes, confirming for visually impaired.
Mm-hmm. You know, we did, I have it, and you know what, we did bring up, like, we want this to be inclusive design. I can't confirm. I feel so bad. I can't confirm about that piece, but like that is going to be probably our part of our quality assurance piece as well, to dig deeper. Thank you for that
Yeah,
question.
and I recall that in those conversations, there was like conversations about different plugins that we could get for the site. But I don't recall if they've been included thus far. But yeah, into the future, it's definitely a consideration we need to make.
We're going through quality assurance right now, so this is helpful for us.
And the other thing would be cost, right? Like on top of that, you guys did mention budget. So any of those plugins you're adding are just going to add. And of course, you're going to reach a point where there will be some where people say, no, you can't add that. So looking maybe at the language piece first, because I agree there could be a plugin just to help with translating the entire site. That's certainly possible. Or is it something different? So I like those ideas, and don't feel bad, Cynthia. You're just going to make a note of it, right? And then those are things now that you can take to make it even better, right? For sure.
Great. It's 11:43. We have one more question that I think we can answer before 11:45 and lunch. Again, our afternoon session resumes at 12:05 with curative treatments. The last question in our chat is, do you plan on being able to support online groups, online support groups? Really interesting idea.
I would like to see that. And like, I think this is part of our strategy of building online virtual care. I think this is part of that, right? Because as I mentioned before, we had no way of communicating with patients collectively, right? So this could be part of, that capacity building for that.
That's really fantastic. The website looks amazing. I can't wait for it to launch officially and to have the opportunity to be more part of a inclusive and empowering relationship in the sickle cell community. So thank you, everybody. Any last words? And we'll head off to lunch.
Just want to say thanks, everyone, for joining today.
Thanks, everyone.
Right. Thank you so much. Have a great lunch, and we'll see you this afternoon.